Welcome to Gracefully Graying. I am co-founder Lori Bloom. Explore a platform of tips, trends, news, and informative discussions for you and your loved ones. Whether you're 50 and over or way over, find us on gracefullygraying.com, YouTube, and social media. Enjoy this live stream discussion. Welcome to Gracefully Graying and Tuesday live stream. Today, we are thrilled to have Beverly Price, a certified eating disorder registered dietitian with the Rochester Center for Behavioral Medicine. And Beverly, welcome to our live stream.
Thank you, Lori, for having me this morning.
Yeah, I know you have, a great background. You do really good work for a lot of people. I know that. Today, we're going to be talking about nutrition-related concerns for women over 50, specifically, which kind of obviously leads to our focuses on our demographic. So, first of all, what is your background that led you to become a registered dietitian, and what led you specifically to your interest in helping women over 50?
I was interested in nutrition as a little girl, and that carried on to my interest in going into nutrition when I reached college. I majored in dietetics, and I took my career from there, started out more in cardiac fitness, and then branched off into eating disorders work. But even as under 50, all my career, I've always been interested in women at menopause and beyond as far as nutrition and other health related concerns.
Okay. Yeah, that's amazing. So, what are the nutritional concerns for older women as it relates to, say, heart disease? I mean, I know that that's a big thing. It affects a lot of people. And also, is there a specific age when we need to begin maybe paying more attention to what we eat? As it relates to our heart specifically. What about that?
Well, really, all of our lives, it's a preventative, not just starting at age 50.
Mhm.
However, the risk of cardiovascular disease increases in women over 40, and then even more when a woman hits menopause. Because with menopause, women lose the protective effect of estrogen. And the risk factors for heart disease include diabetes, high cholesterol, triglycerides, a poor diet, excessive alcohol intake, lack of exercise, and also additional weight. And of course, stress is a major factor.
Okay. Um, and it's not, you said it's not necessarily age 50, but obviously it could be, begins a lot earlier than that. Maybe some of that has to do with family history, or is correct?
Yes, correct. And women don't necessarily have the same symptoms when they're having a heart attack as men. And really, over the years, we've learned so much more. In the early days, the studies on cholesterol, for example, and heart disease were mainly done in cohorts of men. So we're just seeing more information now, reading more information on women and heart disease. But really, they may not even have any symptoms and have a
Yeah.
heart attack, and and we don't know that. So I think women really have to listen to their bodies, pay attention to what's going on, and understand that just strange feelings and just not feeling right can lead to,
Yeah.
you know,
So, well, let me ask you then on that note. I mean, through data and research, do you know, or do you find that this heart problems happens because more often because of genetics or hereditary, uh, stuff going on with that, or because of diet and what people eat? Like, is it? Do you know if there's like the data supporting one or the other? Or?
it's multifactorial. It really is. So
Mhm.
you have to consider all of that plus stress and physical activity. Lack of physical activity can be a risk factor for heart disease as well.
Yeah. Okay. Um, Okay, so obviously eating disorders can happen at any age. I mean, from young child, preteens, really at any age, and it also happens in older adults. Obviously, I mean, you see a lot of that. Do you see a rise in that right now? Do you see a rise in that, and maybe speak to COVID? Maybe it's more prevalent now because of COVID.
We do, and even pre-COVID, we were seeing a rise, and also not really knowing it because our stereotype over the years has been it's this young teenage girl who
Right.
struggles, and
Right. Like when
she's
you think of eating disorders, you kind of think of that, right? But
Mhm.
that's not always the case.
No, and really a total that we know right now, a total of 13% of US women over 50 years of age and older have eating disorder symptoms. And
Well,
this is slightly more than the percentage diagnosed with breast cancer.
oh, really? Wow, that's a
Uh-huh.
statistic. Wow, I
Yeah,
think
yeah,
we don't really know that. That's kind of shocking, actually.
it is. And as far as what perpetuates it, it's stress, pressure in the workplace, perhaps, and over 50 years old, women tend to be dual caregivers of both aging parents and their young adult children,
Right.
and this causes changes in their marital and family relationships. But also, we have change of hormones that can
Mhm.
shift physical changes that affect women's perception of their bodies, and the natural progression of aging is often shocking to a woman who's maybe set up to develop an eating disorder. And it could be also that women have struggled at a younger age, and as far as treatment for this cohort years ago, there really wasn't treatment, and there wasn't this acknowledgement of the disorder. So now it's
Right.
coming to the forefront, and women are offered treatment, and that's really important.
Right. And you mentioned menopause. I mean, menopause could happen at various ages in women, right? I mean,
Mhm.
what do you find kind of the range to be?
We know that it has started as young as mid 40s, and
Mhm.
it just depends on the woman's history. Often with women, it parallels the mother's history of when they began to go into menopause.
Right.
So we can see that. But you have to really be prepared for anything. And as far as just the cultural, societal messages from the eating disorder standpoint, going back to that, this desire for youth, vitality, and especially in our age,
Yeah.
you have so many products out there. When we were younger, you had a few hair products. You really didn't have a lot of skin products. And now there's so much out there that
Right.
messages you have to be young. You can't age.
Right.
So that is a contributing factor.
Right. Right. So how can, pardon me? Oh, how can family members, on that note, recognize if they see in a loved one or a good friend that there might be a problem? What are some signs of that?
Signs are perhaps talking about one's body, complaining about one's body. Oh, I feel this way. Oh, I feel that way. Restricting food, maybe making excuses. I don't want to go to this dinner party. I don't feel well.
Mhm.
Avoiding social situations, isolating, and also maybe even in the extreme, finding signs for somebody who is is struggling with bulimia, where they are compensating by getting rid of food and
Mhm.
finding these signs all over, vomiting,
Yeah.
um, you know, to that extreme.
Right. Right.
But
And
I would also do want to mention, we tend to forget about binge eating disorder, and that is also common as women age. And those symptoms can be, you recognize somebody gains weight very rapidly, their eating behavior is erratic, and they're eating compulsively, large quantities of food. So those are other signs as well on that extreme.
right. Right. And what could you attribute that to? I mean, why would that be happening? What are the causes of that?
Again, it goes back to the same causes of anorexia, bulimia, stress at home, stress at the workplace, and
Mhm.
again, just body changes. and hormone changes that cause a physical shift.
Yeah. Okay. Um, a lot of time we think of weight and your own self-image and your own what you perceive your I don't know, a weight problem. I mean, that seems to be a big thing, like judging people by their weight, and which is horrible. But as we get older, it's more difficult to control weight. People, it could be more difficult to exercise, and if one's not used to exercising, then it becomes a problem. Talk about exercise and eating disorders.
Are you asking about eating disorders or weight management and exercise?
Uh, Say that again.
Are you asking me about exercise and weight management or exercise and eating disorders?
Exercise and eating disorders. First of all,
Okay.
we'll do that
Okay.
first.
Well, exercise, how I look at it from a standpoint for eating disorders, I'm looking at as somebody exercising excessively. And that's more of a category of bulimia, where somebody is exercising beyond balance, where they're trying to compensate by getting rid of calories. And that's not really healthy either. So we look at that as far as when I do a nutrition assessment, those questions to see, is this individual exercising where it's just not healthy.
Okay. Right. And so, it's like a chicken and an egg. Are you exercising because you have an eating disorder, or are you, like what comes first here? Are you, trying to solve your eating disorder, or maybe keep it at bay, and you're exercising too much or not enough, or so I guess my next question would be, share some insights in, the mid to older adults and women, as far as, you know, triggers and habits and lifestyles of weight gain, which would then present an eating disorder. Like what would be a trigger for that?
Yes, as far as weight concerns, then perpetuating an eating disorder. And what happens is, just throughout our lives, every decade, women are putting down more fat and they're losing muscle. So that's just a process of aging.
Right.
And these contributors also to weight gain include declining estrogen levels and lifestyle factors, diet, exercise, and again, women who are caregivers but also raising children, and maybe stress at work, because stress produces certain biochemical markers that can affect the processing of food and how food is utilized in the body. And therefore, weight gain can happen. This is a very simplistic, trying to break it down very simplistically.
Right.
All right,
Right.
so the end product is a woman. It's easier for her to gain weight. And really, my advice as far as weight loss is to stop dieting, because dieting is going to increase a preoccupation with food, and it's going to blunt hunger cues, and it can result in serious eating disorders. A diet oftentimes is the start of an eating disorder. And even with somebody who struggles with binge eating disorder, for example, the recommendation is not weight loss. It's really normalizing eating habits. And really, whatever you need to do to lose weight is the exact same thing that you must do to maintain weight, and people don't realize that. And this is why people who embark on diets, they typically lose about 5 to 10% of their starting weight in the first 6 months, and it's possibly maintained for a year. And this way, cardiovascular risks decrease, diabetes risks decrease significantly. However, at least 1/3 to 2/3 of people on diets regain more weight than they lost within 4 or 5 years. So the statistics are really grim.
Right. I mean, yeah. So what you're saying is it's really about changing your lifestyle very long term. We're not talking like a fad diet. We're not talking, you really have to change it long term, like years, correct?
Correct. And even the physical activity is very important, because because muscle requires more calories. And if a woman is putting down more fat cells, they're losing muscle, the fat is going to require less calories.
Mhm.
Muscle requires more. So if they can build more muscle in exercise,
Mhm.
then they can keep their metabolism going and more likely have success.
Right. But still eating plenty because you're burning more calories.
Well, eating balance. It goes back to eating
Balance. Yeah.
balance. Yeah,
Yeah.
yeah. And it's really no different. And again, working with the registered dietitian on an individual plan, because
Mhm.
an assessment is really important because what works for you may not work for the next person, the next person, the next person. So it is very individual. And again, not focusing on weight loss, but
Right.
focusing on balance and and looking at the byproduct long term.
Right. Okay. Yeah, that makes perfect sense. So, well, let me ask you, are there certain foods or food groups that seniors should stay away from? Now, this I must admit, I love chocolate. I have to eat chocolate every day. But tell us about certain food groups, that people should stay away from. Probably sugar.
Well, again, I love chocolate too. I'm
Okay.
right there with you. Really, it's you could eat what you want, but it's how much. And again,
Hmm.
there is a balance. Obviously, fruits, vegetables, whole grains, lean meats are going to be better for somebody who's trying to work on prevention. But again, you don't want to cut out food groups. You don't want to cut out things you like, some desserts, just eat them in moderation and pay attention to hunger and fullness. Eat when you're hungry, stop when you're full. And that's where a dietitian can help to, to educate about hunger cues and practice, work with experientials.
Right. Okay. Yeah, that makes great sense.
Mhm.
So tell us, how is your adult weight management program different than other, you see a lot of weight management programs out there. You see supplements, you see all of that. How is yours different?
Well, fan diets have been around for years and years and years.
Mhm.
And now we're getting into a lot of these online programs. And that's really more detrimental to a woman's self
Mhm.
esteem and long term physical health. And really, our program is unique because it offers no gimmicks, no flash, no dash. We just get the job done.
Mhm.
And a lot of the programs out there are devoid of the psychology behind it. So we
Right.
also have therapists at RCBM that will work on the emotional side. So together as a team, and our prescribers can look at different medications because perhaps we need that boost of medication for help. And the prescribers, the therapists, dietitians all can work together
Right.
to help this individual, to help this woman.
Right. Okay. RCBM meaning Rochester Center for
Rochester Center
Behavioral
for
Medicine, in
Behavioral
case
Medicine.
people are
Yeah.
wondering what that
What that
acronym
acronym
is.
is.
Yeah. But I know you have amazing teams. And so every patient of yours benefits from a whole team always.
Yes,
Okay.
absolutely. We work together, and that's really what is Rochester Center's specialty. What
Yeah.
makes us stand apart is that we have a comprehensive team. And a lot of these online programs for therapy are really devoid of working together. They're
Yeah.
all spread out all over the place. There's not team meetings to discuss different concerns.
Mhm.
And we have a face to our program, Dr. Young,
Mhm.
and a lot of these online programs don't have a face. It's hard to get medications, and there's been a lot of issues. I think as reading about them and the problems.
Right. Okay. Well, that's great. So overall, because the topic of this particular discussion is women over 50, I mean, what general advice could you give people if somebody's watching this or somebody knows of a loved one, and they may be having a problem? I mean, obviously, they should get a hold of you. You know, what's your overall advice?
We're here to help. And there are three of us, three registered dietitians at Rochester Center. And we all are trained in eating disorders. We're trained in a variety of nutrition topics. And they can contact us going through our website, they want to make an appointment, they can pre-register online. We have a really streamlined system, to get patients in for help.
Yeah. Okay. So that's great. So, yeah, you've just shared with us how people can get a hold of you. That's great. We really appreciate your expertise. We've come to the end of our discussion. I feel like we could talk about so much more. So we will have you back on to continue. We thank you to all of our sponsors of Gracefully Graying. And Beverly, I'm sure you just help a lot of people. And I thank you for the good work that you do and your team. And we're really glad to have you on Gracefully Graying live stream.
Thank you, Lori.
Okay, thanks so much. And we will see all of you later. And find Gracefully Graying at gracefullygraying.com and on social media.